Hey guys, it's Francesca. I wanted to talk a little bit about some of the words that you're hearing thrown around and what they mean and how they're different, and also viruses versus bacteria and why viruses are hard to treat, and why soap actually works really well, especially for this virus. So to begin with, you've heard COVID-19. COVID-19 is actually the name of the disease that is caused by the virus, which is called SARS-CoV-2, okay? And SARS-CoV-2 is one species of the family of coronaviruses. There's actually over 40 different species of coronaviruses. So SARS-CoV-2 is just one of those species, and it's the virus that causes COVID-19, okay? COVID-19, what it means, what it stands for is coronavirus disease, COVID 2019. And SARS-CoV-2, where that name comes from, I'll explain some of this medical mumbo jumbo in a second, but it's SARS, Severe Acute Respiratory Syndrome, SARS, associated with coronavirus, CoV. Number 2, because SARS-CoV-1 was the virus that caused SARS, which is confusing because in that case, the virus and the disease that it caused actually had a similar name. SARS-CoV-1 caused the disease named SARS. SARS-CoV-2 causes the disease named COVID-19. And in case you're curious, severe acute respiratory syndrome means really bad, fast onset lung infection that may be associated with other symptoms. Okay? That's what that means. And just fun fact, coronaviruses are named this because, as I'll show you in a second, they have all these little proteins poking out of their membrane, and so it kind of looks like a little crown, corona crown. There you go. Okay, so that's kind of some of the terminology. Let's talk a little bit about a virus versus a bacteria because this is very confusing. And both of them are considered germs. Germ is not really like a medical word, but they're, microscopic and they cause infections, right? Viruses are on average about 10 times smaller than bacteria, which are on average about 10 times smaller than a human cell. Although the human egg, which is just barely visible with our eyes, is about 1,300 times bigger than SARS-CoV-2, one little tiny particle of SARS-CoV-2. So viruses are really, really tiny. And they're also much simpler than bacteria. It's kind of a gray area as to whether we would even consider them to be alive, because they can't reproduce on their own. Viruses are basically little packages of genetic material wrapped up in protein and or fat, and they kind of float around and they bind to whatever it is that they're infecting, the cell that they're infecting, and they inject their genetic material inside, and then that cell basically gets tricked into making more of the virus and releases it out, and then those little virus particles go on their way. Okay, so this is why antibiotics don't work for viruses. Antibiotics, by definition, are to treat bacteria. And a lot of like cold symptoms and sinusitis and some of the bronchitis, some of the things that really make you feel like garbage in the winter months are caused by viruses. And if we were to give you an antibiotic which treats the bacteria, it wouldn't do anything because it's not affecting the virus. Okay, let's talk about this virus. I drew you guys a picture. I know, it's definitely one of my finer pieces of work. So you've seen some variation on this, right? All over the internet, every time you look anywhere ever, usually in black and red and super scary looking. But this is my version. And basically what we have is there's a little fatty membrane, and this is kind of like if we cut through it, right? So it's actually ball shaped. And then there's little proteins poking out of it. And then inside there's this little swirl of RNA, of the genetic material. And what happens is that these proteins bind to our cells and they cause it to sort of open up and fuse with our cell, and then that RNA goes into our cell and our cells start making more of these virus particles. This little fatty membrane is important because for two big reasons that I wanted to talk about. One is that it looks a lot like our cell membranes. So when we try to create a medicine that kills this virus, we have to be careful if we were to target that fatty part, we might damage our own cells. And as you can see, there's not much else going on in there except RNA, which we also have in our bodies. And so we just have to be careful when we're killing a virus that we don't also cause damage to our own cells. Whereas bacteria they have a cell wall, they have all these other things that our cells don't have. So they're a little bit easier to target because they're not as similar and they're not as simple, they're more complicated. The other reason that that little fatty layer is important is because if you think about a dirty pan that's got fat and grease on it, and you put soap on it, it cuts right through the fat, right? Same thing happens with this virus. The soap basically cuts through it and sort of surrounds it, and then when you wash your hands, it breaks it up into little tiny pieces, and it goes down the drain when you rinse them off with running water. All right, I hope this was helpful, and I'll be sharing some more videos soon. Stay safe, guys.